Good morning, everyone, and welcome to Zuellig Pharma's second Healthcare Access Summit. Our theme today is Building a Healthier Asia, empowering more equitable access to healthcare innovation. My name is Tony Estrella. I'm an author, podcast host, and strategic futurist for personalized health and health equity. I'm honored to be your host today. Health equality is a subject which has shaped the world around us throughout the COVID pandemic. The challenges for how access and affordability affect the ability for people across Asia-Pacific extends to all aspects of health, including prevention, health literacy, early diagnosis, and care. Today, we'll hear from many experts from across Asia-Pacific who will dive into the key enablers and barriers which need to be systematically addressed to improve health equity for all. Now, throughout the session, you'll have opportunities to submit questions for the speakers and also to give feedback by scanning a QR code, which will bring up on the screen at the end of each panel. And because we're here with you until 3 p.m. today, we'll have both a short morning break and a time for lunch. Now, to get us started, I'd like to invite the CEO of Zuellig Pharma, John Graham, to share a few opening comments with us.
Thank you, Tony, and good morning, everyone. It's great to be here with you all, and a warm welcome to this interesting day of events. On behalf of Zuellig Pharma, it's really my privilege to welcome all of you to today's summit on building a healthier Asia, empowering more equitable access to healthcare innovation. As many of you know, we successfully hosted our first virtual summit last year on immunization, right in the middle of the pandemic, where we connected with over 1,700 attendees from over 24 countries, including partners, customers, suppliers, employees, government officials, and of course, healthcare practitioners. This year, we want to broaden the scope of the summit and look at the larger questions around enhancing access to innovation in the healthcare systems in Asia. Over the past decade, major leaps in healthcare technologies have transformed and elevated the quality of and delivery of care, from therapeutics to diagnostics to procedures and many other interventions. The rapid development and distribution of COVID-19 vaccines has saved millions of lives globally and has demonstrated what is really possible in times of need. However, these breakthroughs in innovation have in some cases widened existing gaps in healthcare and equity across and within our markets. Closing these gaps will require addressing barriers related to healthcare financing, availability of healthcare services, supply and distribution of products, and developing enablers such as strategic partnerships and trust among the different stakeholders in the healthcare system. In this summit, we want to explore these barriers to equitable access, to innovation-driven, value-based healthcare, and hear about these enablers and potential solutions for improving patient access to innovation in Asia. Many of the individual sessions will focus on specific barriers by bringing together different perspectives to address a specific challenge. We will also hear learnings from the pandemic response, what worked well, what needs to be improved. The sessions will be linked by overarching themes of innovative business models driven by digital technology and strategic collaboration and partnerships. We're so pleased that we can contribute to these important debates, and I wish you all a successful and interesting summit today. Maybe with that, I'll pass back to Tony and we can get the show on the road.
Thank you, John. Thanks for your leadership to bring us all together here today to engage in this lively discussion and debate about what needs to happen to improve health equity. This challenge of addressing health equity is not confined to one country nor one region. To share more about the collaborations that exist across the EU and ASEAN, I'd like to invite Chris Humphrey, Executive Director of the EU-ASEAN Business Council, to share his thoughts with us.
Thank you very much, Tony. Ladies and gentlemen, distinguished guests, a very good morning to you all, and greetings from Jakarta, where I'm currently sitting, hence the batik shirt. My name is Chris Humphrey. I'm the Executive Director of the EU ASEAN Business Council, and I'm very, very grateful indeed to the organisers for inviting me to speak to you this morning. Just a brief introduction about the Council and the work that we do. We are the primary voice for European industry across all of the Southeast Asia region. We are officially recognised by both the European Commission and the ASEAN Secretariat, are indeed an accredited entity to ASEAN under Annex 2 of the ASEAN Charter. The work we do primarily focuses on trying to improve the trade and investment climate between Europe and ASEAN, as well as in ASEAN for European industry. And a lot of that, of course, is focused on very traditional things like market access type issues. But increasingly, we're moving more into the non-conventional trade agenda, and that includes looking at healthcare issues a lot more. We engage a range of ASEAN bodies, including ministerial bodies, to help develop closer ties between ASEAN and Europe and promote improvements in the business climate, enhance understanding, and in the context of health, develop a range of ideas and recommendations to assist the region in improving both access to healthcare and in the delivery of healthcare. In fact, our healthcare and life sciences grouping is probably our most active group of members in the council. And through that grouping, we produced a number of publications which I think are relevant to some of the discussions you'll be having here today. Sustainable healthcare financing, trying to look at how we can actually afford to have universal healthcare coverage without breaking the bank or putting undue stress on patients' pockets. The need for life course immunization, particularly to protect our elders from common diseases and infections, and thus reduce the burden on the healthcare system. Improving self-care and access to over-the-counter medicines to enable people to take better care of themselves, look after their own personal well-being. And most recently, a report on the value of diagnostics, an often underappreciated but crucial part of the healthcare continuum. The COVID-19 pandemic served to highlight the vulnerabilities that exist in the healthcare systems globally, even in highly developed economies. When we look across Asia, those vulnerabilities were underscored even more. It was a wake-up call for all of us and put healthcare issues to the forefront of everyone's minds, from governments to businesses to NGOs and indeed to the general public. But even before the pandemic, healthcare issues were flagged as one of the top priorities in the ASEAN Economic Community Blueprint 2025. This is because surveys and research have predicted that by 2030, across all of Southeast Asia, we will face a problem of a rapidly aging population. Today, we think of Asia as being a young region, which it is, but today's youth are tomorrow's elders. Somewhere like a Thailand will very soon have a demographic profile that is not dissimilar to that of Japan today. This will ultimately drive up healthcare expenditures, create a rising demand for the provision of adequate healthcare, and cause a change in the type of healthcare that needs to be delivered. ASEAN therefore has made it clear one of their priorities is to ensure that not only promote a healthy lifestyle for citizens to age gracefully, but also develop their capability to address hazards and emerging threats, as well as to strengthen healthcare systems and ensure accessibility to care for all. It is an ambitious goal, but not an unattainable one. They have made great strides forward, but more needs to be done. As the dialogue and discussions today will show you, there are no doubt barriers that need to be addressed before the region can achieve their goal, especially when it comes to providing equitable access to care for all. Southeast Asia will need to address issues like managing limited resources to achieve better healthcare infrastructure and better affordability of healthcare, leveraging on innovation and digital technology to decentralize patient care, especially for those living in rural areas. We can learn from some of the lessons that the pandemic has given us. For instance, using telemedicine, remote diagnostics for those away from urban areas or who have difficulty in traveling. These are just some of the previews of the discussions that you'll be witnessing today. From these, we will hopefully find ideas and potential solutions for improving patient access across Asia, lowering cost of patients and the healthcare systems, but improving diagnostics and delivery of treatment at the same time. I am sure, as we have witnessed throughout the pandemic, stakeholders, be it public or private sector, cannot resolve the healthcare problems alone. Collaboration is key. It is a whole of society issue. It is not just for health ministries, but for all of government, and within government in particular, the finance ministries. But it must also involve the private sector, the pharmaceutical companies, those working on medical devices and diagnostics, those involved in distribution, and those involved in the direct delivery of care. And we must also make sure that patient groups are not forgotten as part of that discussion. When stakeholders work together and commit rapid development in vaccines and technological advancements in healthcare can be the reality. Nonetheless, those attainments and innovations in healthcare will only really mean success for people who truly need them, the most vulnerable groups in society who are able to gain access to them. This is why it is important to discuss areas of strategic collaboration and partnership to ensure that healthcare as a universal good can be made accessible to all, young or old, rich or poor, urban or rural. This is vital, not only for us to tide through what is now, hopefully, the end of the pandemic, but also prepare ourselves for future calamities and to ensure that we are equipped to address the problems of a rapidly aging society where our region is headed towards. Before I end off, on behalf of the Council, I would once again like to express my sincere thanks to be a supporting partner for the event today. And I would like to reiterate that the Council stands ready to assist our members and relevant stakeholders to help build a healthier Asia, make ASEAN's post-2015 health development agenda of developing a healthy, caring and sustainable ASEAN community a reality. I wish you a fruitful discussion ahead and a great success of this event. Thank you very much.
Thank you, Chris. Especially appreciated your thoughts on making sure that we take care of vulnerable populations. That is clearly a wake-up call that we in the private sector and in governments have to focus on. I think I can speak for many of our attendees and speakers in the importance of finding ways to collaborate effectively and co-create together to address these health inequality challenges which you've raised. The Asia-Pacific region consists of more than 4.5 billion people spread across more than 40 countries. If there's one word that can universally describe people living in this region, it's diversity. From archipelagos to mountain villages and cities overflowing with millions of people, there is no single approach to solving access and affordability challenges. We can learn from each unique health system. And this morning, we'll open our discussion with two speakers who will comment on the current state of affairs in Southeast Asia. First, we'll get started with a deep dive into the Philippines and what it means for that country and other Asian countries in pursuing the best care anywhere, how to achieve access for all healthcare innovation. First, I'd like to welcome the officer in charge of the Department of Health in the Philippines, Vera Jure, to deliver our plenary keynote.
A pleasant morning to all of you. Thank you for inviting the Philippine Department of Health to the Zuellig Pharma Building a Healthier Asia Summit 2022. Thank you for giving us the opportunity to discuss our initiatives in providing quality healthcare services to all Filipinos in the country. The Universal Healthcare Act set forth a healthcare model that aims to provide all Filipinos access to a comprehensive set of quality and cost-effective continuum of healthcare services through population coverage, service coverage, and financial coverage. It is through this framework that we hope to introduce major reforms and changes in our healthcare system, with the goal of ensuring not only geographical but also financial and social access to quality healthcare with protection against financial risk and catastrophic costs. In the Philippines, there are a total of 206 licensed primary care facilities, of which 98.1% is shared by the public sector and only 1.9% owned by the private sector. Major access sites to these primary care facilities are concentrated in Region 2 with 71 primary care facilities, Region 5 with 67 primary care facilities, CAR with 39, and the rest scattered among Regions 3, 4A, and 4B. There are 1,289 licensed hospitals in the country with an authorized bed capacity of 109,647. Out of this, 849 or 65% are privately owned and 440 or 35% are owned by the public sector. In terms of density, we have 817 Level 1 hospitals, 351 Level 2 hospitals in the country. Using the region as the catchment area for Level 3 hospitals, Barm, Caraga, and Zamboanga Peninsula, the regions with the highest poverty incidence in the country, only the Zamboanga Peninsula has a Level 3 hospital. This is compared to the urban areas such as the National Capital Region having 59 Level 3 hospitals. While the number of hospital beds have increased over the years, it has not kept pace with the fast-growing population. Our current bed-to-population ratio of 0.99 is comparable to those of the poorest countries in the world. Cambodia has 0.9, Indonesia and Myanmar has 1, Malaysia has 1.9, and Vietnam has 2.6. Due to the presence of both physical and socio-economic factors, we have geographically isolated and disadvantaged areas. At least 25% of sitios and puroks have no access to an RHU nor a hospital within 60 minutes of travel in any form of transport, including walking. On average, only half of the population has access to such facilities within this travel time. Barm, Bicol, and Mimaropa are the three regions with the highest share of the population without access to an RHU within 30-minute travel time. Based on our latest data, out of 39,753 barangays in the country, 10.82% or 4,363 are GIDA barangays. To provide the best available health care, we are doing rational reallocation aligned with the Philippine Health Facility Development Plan. The Philippine Health Facility Development Plan 2020 to 2040 studied the health infrastructure and equipment needed in the country to achieve universal health care. The updated Philippine Health Facility Development Plan has targets that are based on the current and projected burden of disease and the needs of our population. The plan includes an allocation framework that promotes efficiency and equity based on the service delivery model that is aligned with the universal health care. It calculated infrastructure requirements to build healthcare provider networks. In addition, the role of the private sector is included. We aim to achieve these targets by 2025. 6,258 primary care facilities, which includes rural health units and private medical outpatient clinics. 191,218 Level 1 hospital beds, 76,581 Level 2 hospital beds, and 75,475 Level 3 hospital beds. The plan proposes a national allocation framework which objectively guides resource allocation for local governments based on the resources of the local government, the presence of a GIDA, and the level of household income. Local governments are categorized depending on the capacity and the calculated gap. To promote equity, a higher allocation is given to low capacity compared to high capacity areas and high gaps compared to low gaps. This framework was also used as the basis for our Health Facilities Enhancement Program Devolution Transition Plan in their gradual and partial devolution of functions. The gaps in beds may be addressed by building new hospitals or by expanding existing hospitals or infirmaries. However, this has to be matched with other resource requirements such as adequate financing, health human resources, and the operational needs. The plan also requires appropriate investments in our health human resources. Under the Department of Health Human Resources for Health Master Plan, the country needs around 65,578 physicians for 2025 to meet the primary care needs of the population. This estimated density of primary care is quite ambitious and is incomparable to countries with robust primary care systems in advanced economies. With access to equitable primary care, every Filipino is afforded primary care consults and services under universal health care. In the event that one requires hospital care, his primary care provider can easily refer him to hospitals within their network. Upon reaching the hospital, ward accommodations are afforded at predictable cost with the option of co-payment. Should regular consultation with a primary care provider, medical conditions such as hypertension be detected, immediate referral to specialty care facilities are coordinated at his most convenient and accessible location. With the leadership of this new administration, the Department of Health has developed the health sector directions for 2023 to 2028 to achieve our long-term goal of making Filipinos among the healthiest people in Asia by 2040. For our health sector strategy, our focus is still on the impact of making Filipinos healthier in terms of better, more equitable health outcomes, responsive healthcare systems, and improved financial risk protection. This will be anchored on the following strategic thrust: enable Filipinos to be healthy, protect Filipinos from health risk, and care for health and wellness, which will be supported by the fourth thrust of strengthening our healthcare institutions and our healthcare workforce. This strategic thrust serves as the key pillars of our health sector strategy for 2023 to 2028, and the implementation of this thrust aims to address the gaps in our healthcare sector. With these strategic directions, we hope that we will be able to address or minimize the barriers to accessing healthcare services as we journey towards achieving universal healthcare. We thank the Zuellig Pharma for its assistance to the Philippine Department of Health in the pursuit of these initiatives. May we continue to work together to improve patient outcomes for all Filipinos and create healthcare systems that provide comprehensive and holistic health services for all. Maraming salamat at mabuhay tayong lahat.
Thank you, Officer in Charge Vergere. My mother was born in the Philippines, and it's wonderful to learn about the investments being made in universal health care and how it can be improved on both in the near term through 2025 and in the long term 2040 goals. Now, let's hear from Rehan Sagir, Executive Vice President, ZP Therapeutics, Zuellig Pharma, to share his thoughts on how the activities to address health equity in the Philippines compared to the broader Southeast Asia region.
Thank you very much, Officer in Charge Vergere, for sharing the initiatives that your government has developed and implemented to provide quality healthcare services for all Filipinos in the country. As mentioned by Dr. Vergere, both the Philippine Health Facility Development Plan 2020 to 2040 and the Health Sector Directions for 2023 to 2028 were developed to help minimize access barriers to healthcare services. Both initiatives touched on the importance of investing in areas such as health infrastructure and equipment and human resources to provide equitable primary care for Filipinos, regardless of their location and socioeconomic status. This is not unique to the Philippines. In recent years, we have seen other countries in Asia, such as Thailand and Indonesia, actively investing in healthcare infrastructure, training of healthcare professionals, and recently digital health solutions to improve the quality of care for their residents. A great example would be Indonesia's health ministry's plans to integrate around 8,000 health facilities with Satu Sehat, a healthcare data integration platform connecting the entire health industry ecosystem to create a single national health database. This presents an important step forward in addressing the challenges in delivery of care due to shortage of manpower and infrastructure deficits. Once the physical and human infrastructure is in place, the next step would be to extend the investments beyond providing the basics and work towards introducing innovative new diagnoses and treatment options that can lead to better health outcomes and health-related quality of life for our patients. This will require new thinking around how innovation is assessed and valued, particularly the value of healthcare interventions as an investment in healthy and productive citizens. Scientific breakthroughs are bringing better treatments and even potential cures for a range of chronic and acute conditions. Yet these breakthroughs are not reaching many patients in Asia, even those in more mature markets. In countries where government funding may be more limited by resource constraints, there are opportunities for public partnerships with private payers, patient groups, and pharma companies, as well as other stakeholders to make innovative treatments more accessible. There are also opportunities to address supply chain barriers that can reduce access due to cost, infrastructure, or even regulatory restrictions. Finally, from a commercial perspective, some companies, especially smaller biotechs from outside of the region, may not have the capacity to reach markets and patients in Asia without partners. While at the same time, smaller markets may need to be open to more creative approaches to becoming attractive destinations for companies to invest in patient access. Equitable distribution of innovative treatments and access to them form a major challenge in the race to get as many people protected as possible, whether through immunization or against non-communicable diseases. Our recommendation is that we, public sector and private sector, develop ties that are even stronger across Asia so that we can collaboratively leverage on one another's strengths to offer a unified response to crisis or threats. One of the most critical areas here, in my view, is the need for us to deploy innovative solutions to strengthen healthcare system resilience. We would once again like to thank Dr. Vergere for going the extra mile to deliver her keynote speech for our summit and to share her initiatives as examples for other countries in Asia to learn from and to improve the quality of care for patients. Thank you.
Thank you, Rehan. I'm particularly attracted to the ideas you put forth in infrastructure investments. In researching the global challenges on equity for my new book, I'm firmly in the camp that new thinking is required from the private sector to help address these infrastructure challenges. These opening comments have helped set the stage for the main part of our program today. Thanks to our hosts, today we'll hear from a wealth of experts from across academia, business, clinicians, and government.